This is ULM Day at the Legislature, and we're here today to talk about the different pharmacy bills that are before the Legislature. We've got about 60 students with us, and we're really excited to be here. The ULM School of Pharmacy is a 4-year degree program. We have about 430 students within our program. The fourth-year students go out across the state and they deliver care to our patients from just about anywhere within the state, from Monroe all the way down to Homa, actually, is about as far south as we send students. So it's very exciting for us, it's exciting for them, and hopefully it's beneficial to the communities that we serve.
Our booth is stroke and cerebrovascular accidents. We chose it just because it's a very important topic in healthcare, especially in our state of Louisiana.
Tell us why you wanted to become a pharmacist.
I wanted to become a pharmacist because there's pharmacists on nearly every corner, literally. So we're the most accessible healthcare profession. We can actually be there hands-on helping within our community.
Why did you pick ULM?
I picked ULM because I was coming from South Louisiana and I really wanted to get a broader scope and understanding of our region and our state. So I interviewed throughout the country and realized I wanted to stay home in Louisiana, but get outside of New Orleans.
Our booth today is over-the-counter medication safety booth, and I chose that one because it's really relevant to pharmacy. It's really important. We're very accessible to patients, so just talking about how to use your medications properly is really important, especially the ones that they're getting over-the-counter where they don't have instructions directly given from the doctor.
Why did you become a pharmacist?
So I want to become a pharmacist because I always wanted to be in the medical field and I wanted to help people. So I felt like pharmacy was a great way to do it. We're very accessible. I really love talking to people and helping.
So the topic of my booth was legislative membership, benefits, and immigration. And so basically, the reason why I wanted to pick that one is because I feel like legislative issues is such a big thing. And also it talked about Medicare. The difference between the different type of Medicare as well as voting, how important it is to vote, more so getting people out there to advocate, make sure you register and stuff like that as well. And also rights for immigration for people who, for medicine and stuff as well.
Why do you want to become a pharmacist?
The reason why I want to become a pharmacist is because I see how active they are in the community. Your pharmacist really can shape the community because they actually see a person coming in and out of a pharmacist daily, and they actually get that interaction between how you're doing, actually see you growing and getting better. So that's my reason why I want to become a pharmacist.
Our booth today is women's health, and I picked women's health because it's an important topic that every woman should know about, and we educate on different diseases and different medical conditions that women can get, different vaccines, birth control, and just information that women really should know.
Why do you want to become a pharmacist?
I wanted to be in the medical field and really help people and educate on different medical medications and vaccines and just help other people in our community.
The topic of my booth was chronic kidney disease, and I think it's important, especially in the South, just because 1 in 7 people suffer from chronic kidney disease, and some of the risk factors include that high salt diet, high sugar diet. So I think just letting people know and giving them the facts can kind of help them prevent these things if we, let them know what causes it.
Why do you want to become a pharmacist?
I definitely want to become a pharmacist. My grandma was one of the most important reasons why. She takes a lot of medication, suffers from a lot of illnesses. So I definitely wanted to do something and be a part of that to help her and my community.
The topic of our booth is Remember the Ribbon. It is an initiative that educates people on the HIV/AIDS epidemic. I decided it was important and that I wanted to educate people on this topic because it is so highly stigmatized, and it's a very important topic that affects people regardless of their gender, their race, their socioeconomic status, and their sexual orientation. And we also provide information to people that gives them areas to be tested as well as pre-exposure prophylaxis such as PrEP drugs.
Tell us why you want to become a pharmacist.
I want to become a pharmacist because I feel that the profession marries my passion for healthcare and my passion for serving people.
Our group topic is for mental health, and so it's important because a lot of people suffer from mental health problems, and a lot of people don't want to admit to that or say that, not that it's a problem, but that something isn't what they want to be. And so we pretty much have this board, and it's important to me because it affects so many different people, so many subcultures, so many communities. And so we want to be able to educate them and inform them on the importance of seeking help and noticing the signs so that not only they can help themselves, but help the people they love that's around them.
Why do you want a career in pharmacy?
I want a career in pharmacy in the same way to help people. My father, he passed away recently. He had diabetes, and so I feel like it's very important to help people with the chronic diseases, because a lot of time people with chronic diseases seem like they're okay and they're fine, but they're suppressed. Their immune system can be suppressed very easily, and something as simple as COVID or something as the flu can take them out. And so I want to be able to help patients every day and inspire them to get their health in order and in control so that they can be with their family and their loved ones.
Our booth is bone marrow, and it's very important because people that have diseases like leukemia, they can be saved by bone marrow transplantation. And for us to get tested to see if we are donors, it only takes 2 or 3 minutes to get swabbed, and that gives them the chance at having a much more healthy and better life.
Why did you become a pharmacist?
I really like the organization involved, and I really like the medical field and the potential we have to help people across the state and within our communities.
My booth is over-the-counter medication safety. I chose that booth to help educate the public about the things that you see on bottles in the aisles at your stores and stuff like that. Sometimes all the words and stuff can get really confusing, so hopefully I'm just able to clear some of the confusion up and tell you what this is for versus what that's for. I decided I wanted to be a pharmacist because it was a nice intersection of my interests in chemistry and biology and healthcare. And I chose ULM because it's the best pharmacy school in the state, and the program's just great. I couldn't be more happy about my decision.
Our booth today represents high blood pressure and how to prevent high blood pressure. And it's very important to me because it's something that a lot of people in our country struggle with and don't exactly know how to prevent.
Why did you decide to become a pharmacist?
I would really love to help people, but I didn't want to get involved with the surgical side, or I would have wanted to be more in the chemistry side, so with the medications and educating people about how to take their medications.
Our booth today represents women's health, and I think it's very important because I feel like a lot of women don't understand what's going on with their bodies and maybe problems that they're having, and I feel that it's important to educate a lot of people in those areas, women and men.
Why did you pick that topic?
Well, I am a woman, and I think it's very important, and I have a lot of women in my life who have a lot of health issues involving their reproductive system, so I feel like it's very important to educate.
The topic for our booth is to end stroke. So I picked it because stroke is something that affects a lot of people, and a lot of people don't understand that there are risk factors that you can work on to avoid it happening to you. And a lot of people don't know how to recognize the signs and symptoms. So we use this thing called FAST. F stands for face, so facial drooping. A stands for arms, so you see a loss of motion in one of the arms. S stands for speech, so if someone kind of has slurred or incognitive speech, and T stands for time, as in time being the most important factor that we need to act on in order to prevent the loss of life.
Why do you want to become a pharmacist?
My grandfather was a pharmacist for over 40 years in White Castle, Louisiana, and I'd love to carry on his legacy.
HIV and AIDS, it's important because it's really prevalent in our minority communities, and I feel like it's important because we debunk a lot of the misconceptions floating around about HIV and AIDS.
Why do you want to become a pharmacist?
I wanted to become a pharmacist to make an impact on my community and make sure that I was able to help my community.
My topic is mental health awareness, and it's important because there's a lot of negative stigma around mental health. What people don't realize is that it's very similar to other disease states, similar to diabetes, flu, things like that. But instead of people asking for help for the mental health illnesses, they sometimes just leave it's all in your head, just deal with it. You wouldn't tell that to someone with diabetes or someone with the flu, just get over it, take some over-the-counter medicine. You would tell them you need to go get help, see the doctor. So that's what we're here for, to help raise awareness for mental health and encourage people to get the help that they desperately need if they need help, or even just to talk to a therapist if they need help.
Why do you want to become a pharmacist?
I want to become a pharmacist because I want to help take care and make an impact in the community. I do love the idea of being a healthcare servant to the community and helping anyone who is in need, whether that's just I have a simple cold, I need help with finding the right medication, or I need counseling. What am I doing? Let me know, how can I take care of myself better?
The booth that I'm working is called Mental Health. The reason why I chose it is because mental health is a big issue that we face in our society today. I do feel that a lot of people are not very open to talking about mental health, so I want to be here to advocate for that.
Why do you want to become a pharmacist?
The reason why I wanted to become a pharmacist is because back home, a lot of people in my city and town are not very educated medically on how to take their medication, so therefore I want to give back to them and give them a new insight on how to take their medications.
The topic of our booth is childhood and adult immunizations, and so the reason it's important is because we want everyone to be immunized to protect against viruses that are preventable. And so what we do is we show them how to access the CDC's immunization schedule website, and you can see which immunizations that you need or which immunizations your child needs to be up to date on their vaccines so that we can prevent all the viral infections.
Why do you want to become a pharmacist?
I would like to become a pharmacist because pharmacists are the most accessible healthcare providers, and I would really like to be that person to be able to help anyone that doesn't have access to a clinic or a physician. Like, we're the first line, easiest to walk into a pharmacy and just start a conversation with a pharmacist. So I want to just to help people, yeah.
Our booth is Remember the Ribbon. The reason why I picked Remember the Ribbon booth was because HIV and AIDS was very important to me. I feel like it's very important to encourage HIV and AIDS and promote the importance of it.
Why did you want to become a pharmacist?
I wanted to become a pharmacist because I wanted to not only help myself but help my community and affect lives more than myself.
My topic was diabetes, and diabetes is a really important topic. I chose that one because it runs in my family, and I mean, down here we love to eat. We have big portions of food, and that leads to having type 2 diabetes, and I feel like it's really important to have your health, take care of your health and make sure that you're doing the things that you need in order for you to be healthy and to live a long life. So that's why I chose diabetes.
Why do you want to be a pharmacist?
I wanted to be a pharmacist because my mom, she's very sick. She has fibromyalgia and lupus, and she really suffers with that. And when I was growing up, it was kind of amazing to see how the doctors and the pharmacy worked together to find her a regimen for her medications and to make sure they didn't interact and to make sure like they were helping her and stuff. So I really thought that was amazing, and I wanted to give back to what my family got.
I picked ULM for multiple reasons. For one, it's a little bit closer to home. I do love the community here. The community is very close-knit, and it feels like a family. There's a lot of different other factors as well, such as the fantastic education that I've been receiving.
ULM gave me a lot of opportunity. I love it there. They very much have a welcoming home. It's like a family. So therefore, I love it there, and I just can't get enough of it.
Both my grandfather and my dad went to ULM, so it's kind of like a family tradition.
I picked ULM because I wanted to have an easier transition from undergrad to pharmacy school, and when I toured the school, I just really liked it, and they were very supportive and helpful. So.
It was really the most cost-effective choice, and I'm really grateful to have made that decision.
They have a great pharmacy program. The teachers are great, and our class is very close.
What would you say to?
The reason why I picked ULM, I'm actually a transfer student to ULM, so I like the diversity that I had there. Coming from like being in South Louisiana my whole life, going up to North Louisiana, it was just like a whole bunch of different cultures that was there, and it kind of was really cool for me to more explore and more so just have a bigger diversity.
ULM is one of the best pharmacy schools in the state. I really loved how homey it is. I knew a couple people that had gone there, and they really loved their experience, so that's why I chose ULM.
I actually did my undergrad at ULM, and just the family environment and the community, and that also translates to the pharmacy school, just kind of solidified my decision to do my graduate program there.
I picked ULM because it's where I studied for my undergraduate, and the College of Pharmacy really drew me in with their family and their love and their great scores and education levels.
It was multiple factors that guided me to ULM. I wanted to pursue a career in pharmacy, but I also wanted to cheer, and so I feel like everything. I was a cheerleader, and then I pursued pharmacy, and then I just loved the campus and the people who was there, and it just seemed like a close-knit family, so that's why I decided to be at ULM.
I selected ULM because I had completed my undergraduate degree there, and it was closer to home, and I really did benefit from being on the campus. So ULM has my heart.
ULM is something, my aunt went to ULM as I was a child, and I saw how much she loved it, and I'd always wanted to go there since I was little, and it's the best on the bayou.
ULM College of Pharmacy is the only state-funded college of pharmacy within Louisiana. Our students are very marketable. We have students that are placed after graduation in just about every state across the country.
How can people get more information?
Please, by all means, visit our website at ulm.edu.